Beautiful woman, I hear some of you use potash, lime, salt water, ampiclox, alabuku as a method of emergency contraception. How true is that? Hello, you're welcome to my channel. I'm a registered nurse here in the UK. My name is Oge. You're welcome back. So in today's video, I'll be addressing emergency contraceptives, myths and facts. Can Postinor 2 cause infertility? Can it damage your womb? Everything surrounding emergency contraceptives, I'll be discussing it with you in today's video. So there are unconventional and unproven emergency contraception that I hear people use, such as ampiclox, salt water solution, lime, potash, and alabuku, or other kind of traditional medicines that people use as a form of emergency contraception. Now, there is no scientific backing that the things I just mentioned prevent pregnancy, unwanted pregnancy. It does not flush out sperm, neither does it terminate pregnancy. Please stop causing damage to your health by taking these things as a form of emergency contraception. Now, there are two types of emergency contraceptives. Number one, the emergency contraceptive pill known as Levonorel. Levonorel has to be used within 3 days of having unprotected sex. Now, the second one among emergency contraceptive pill is called Ella-1. Ella-1 has to be used within 5 days of having unprotected sex. Now, the second type of emergency contraceptive pill is the intrauterine device, also known as IUD or coil. Now, this has to be fitted by your healthcare provider, your doctor, or your nurse within 5 days of having unprotected sex. Please take note of this. Now, the ones I just mentioned are the ones that are most common in the UK. Now, in Nigeria, where I come from, the most common emergency contraceptive is Postinor 2. If you are from Nigeria, then you will be familiar with Postinor 2. So how does emergency contraceptive work? Now, it works by inhibiting the release of an egg, or simply put, it stops or delay ovulation. Now, what are the myths surrounding the use of emergency contraceptives? Number one, works when you are pregnant. A lot of people say emergency contraceptive work when you are pregnant. It doesn't. Emergency contraceptive, there's no scientific backing, there is no research surrounding this. So it doesn't work when you are already pregnant. Please take note. Number two, there is a misconception or myth around emergency contraceptive damaging your womb or Postinor 2 damaging your womb. There is no scientific backing to this, to Postinor 2 damaging your womb. All right, there is no research surrounding this, so it's completely a myth. Another myth surrounding the use of emergency contraception is that it can cause infertility. Now, there is no scientific backing or research backing this up. It can only cause menstrual irregularities. For instance, it can upset your menstrual cycle. It can come later or earlier than usual, okay? So, but this is actually not good for women who wants to keep track of their menstrual cycle. You want to conceive, you want to keep track of your menstrual cycle to conceive, all right? So this is actually not so good. This is why it's called emergency contraception. It's not a regular method of contraception, okay? So please try as much as possible to use it in emergency only. Please take note. If you have other concerns, you can discuss with your doctor or your nurse. You can go for a regular method of contraception, okay? So how do you know emergency contraception has worked? Number one, when you see your next menses. In fact, that is number one, and that is the only point. When you see your next menses, that is how you know that your emergency contraceptives has worked, okay? So when do you see your doctor, your nurse, or your healthcare provider after taking emergency contraception? Number one, if you think you might be pregnant, you need to see your healthcare provider as soon as possible after taking emergency contraceptive. Number two, if your next period is more than 7 days late, this is very important. Number three, if your period is lighter or shorter than usual, okay? Number four, if you have sudden unusual pain in your lower abdomen. Now, this could be a sign of ectopic pregnancy and it's a medical emergency. Please rush to the hospital. And the last thing, if you have other disturbing side effects, please go see your doctor, your nurse, or your healthcare provider. I will see you in my next video.